Welcome everyone to another wonderful episode here at Doctors of Podiatry. Hope everyone had a wonderful weekend. A very common clinical presentation that we do see here at Doctors of Podiatry is something that's called interdigital intertrigo. Come around, please. This is a young patient, diabetic. Okay, I'll go ahead and give you guys a sneak peek first. Okay. This is interdigital intertrigo. This is a diabetic patient who presented to our office today. He called in this morning because, and he did the right thing to move swiftly to come see us, because he apparently noticed that there was some blood, maybe a blood blister or something that popped this morning. And we think that at the core, the cause, right? He thinks that it may have been a pair of shoes, European style, narrow in the front, right? Squeezing all the toes together. The problem is that a couple months ago, months ago, when I saw him, I originally recommended that we do a little procedure, because at the core of the problem, he has a bone spur. And the bone spur is what's causing this, right? So for whatever reason, we did not pursue that. And then, of course, he's here today. And now, you know, this is sort of like falls into that vicious cycle of, you know, diabetic, especially diabetic patients, you know, noticing a problem, and then instead of prevention, right, we focus and we talk a lot about how do we prevent the problem? How do we prevent it? Come back, please. I want everyone to take a look at this clinical presentation. Look at that hole. That hole could be a little tunnel, or what we call a sinus tract, that may be tunneling into the deeper subcutaneous tissue. What I'm gonna do today is we're gonna go ahead and trim all that to see if there's an ulceration underneath. If there's none, great. Then we just we'll implement local wound care. We'll go through a strict protocol to make sure that this heals with no further complications, and that's it, which is what I'm hoping for. Once it's healed, I'm gonna recommend again that we do that minimally invasive procedure so we can shave down that bone spur to avoid this from happening again. Strike one, strike two. I always tell my patients, strike three, you're out. And the out means that then we have a major problem. At the surface, bone infection, which can potentially lead to other major complications. And we'll leave this segment as at that. Interdigital intertrigo, there can, again, a combination of maybe some fungus, infection. It just kind of just festers in there. There's definitely malodor. I don't see any redness, any streaking, right? Like moving up the foot, which is great. But this is something that's totally and completely preventable. We can prevent this. And thank God that his HbA1c, a very important marker that tells us how his sugars are running in the last 3 months, is, we'll just say, within normal limits. Thank you for watching.